very good because it speaks to the very important point, which we just discovered when we just did this national situational analysis on maternal mental health. The World Health Organization, the Ghana Country Office, with support from the UK government, sponsored this study, and it was revealing that when you talk about the situation of maternal mental health disorder in Ghana, there are big gaps. Okay. And a lot of the issues are, so there is nationally, we don't have a policy in Ghana. And so everything derived from a policy, okay? And the Ministry of Health makes policies. So the policy is not there. So because of the absence of that, we don't pay attention to it, unfortunately. And then we interviewed healthcare providers across the length and breadth of Ghana. And so to your question, nearly half, in some cases more than half, up to 70% of the care providers say they lack adequate knowledge on the subjects.
Wow.
Yes.
These are the care providers.
Yes. Yes.
Okay. And then we have a problem.
We do. I tell you why. It's primarily because during our training, we don't put enough emphasis on it. I teach in a medical school. You would hardly have a 1-hour tutorial for the 1 year that I'm teaching a class that's doing obs and gynae. There isn't a 1-hour tutorial to talk about maternal mental health.
Are you serious, Doc?
Unfortunately, yes.
Till date?
So these conversations plus the work WHO did with engagement with academia, we are now going to see some changes. But this is what it has been. When you are training as a specialist to become a psychiatrist or an OBGYN, hardly. So all the learning you do on the subject, I call it as opportunistic. One day you're on one round, somebody has delivered, and then she's going through some mental health. Then we teach around it. So if you didn't happen to meet any of that during
then
the period,
that's it.
And that's a big gap across midwifery, medical training. But thankfully, we have identified the gap.
This is unbelievable.
I can imagine, And so that's a good starting point.
Okay.
To identify the problem. So as a result of that, the care provider does not even really have the eye to pick it up that this woman, there's a bit of self-neglect, there's a bit of mood. So it's not there. What the mind doesn't know, the eye cannot see. So that has been part of it. To the extent that the women are now telling us that we should look forth for these things and support them.